This patient was referred to me for endodontic retreatment of tooth number 15. According to the patient, the root canal was done by an endodontist about a year ago. Patient says tooth never felt right. It never felt right. And after the root canal and the crown, she mentioned that to her dentist, and her dentist told her that there's some adjustment period after the root canal and the crown, and just hang in there. So patient didn't think much of it after that. It was always a little tender, a little sensitive, and a few days ago she noticed this. You can see small buccal parielis and sinus tract associated with the tooth. That is the tooth number 15, right here, and that's the sinus tract. So she saw her dentist, and her dentist referred her to me. Tooth was tender to percussion and palpation. Probings, of course, you always need to probe. Probings were 2 to 7 millimeters. There was a 7 millimeter pocket on mesiopalatal aspect of the tooth. And let me show you a different angulation PA. Just looking at those different angulations, I knew we were dealing with a vertical root fracture. And let me show you why. Well, that's one angulation, right? If you go to another angulation, now take a look here. You can see that J-shaped radiolucency. And if you go to another angulation, don't see much here. If you go to this angulation, again, you can see that J-shaped radiolucency, and the 7 millimeter pocket was right there. So looking at the radiographs as the girls were taking them, I knew that we were very likely dealing with a vertical root fracture, and what I did was just went ahead and confirmed it clinically. So you always want to probe, you always want to listen to the patient's chief complaint, you always want to percuss and palpate, and probing is very important. Multiple angulation PA is very important. Don't rely on just one angulation, one PA to try to determine what's going on. Multiple angulation PAs, percussion, palpation. Look around, look at the gingiva on the buccal, on the palatal aspect. Look for sinus tract, fistula, swellings, erythema, what have you. And then you put the pieces of the puzzle together, and you can see the big picture. So recommended extraction, of course.